Hello and welcome, dear learners, to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In continuation with the second module of Regulation, Accreditation Measures and Standard Treatment Guidelines, we are with Lecture 20. The Chapter 20 of Clinical Indicators in Healthcare Quality will emphasize more on what is the purpose of clinical indicators, types and classification, the key attributes, development and implementation, and application of the clinical indicators in the clinical areas. So let me come with first with the definition and purpose of clinical indicators. What an clinical indicator is. In the previous chapter, we have seen that how to define what are the reasons actually, and we have seen the classification of the clinical indicators and managerial indicators. And clinical indicator is a measurable feature of the care provided. The care provided to the patient and the entire care which is being taken in the healthcare organization. It is supported by the evidence demonstrating that it is accurately reflect the quality based on either scientific research or experts' consensus. So, clinical indicators are very important to see and to work on the improvement into the patient's care. The indicators are categorized based on their purpose, and therefore we need to see what is the purpose of developing this categorization. Those best suited for internal quality improvement efforts are called as clinical indicators, and those which are suitable for evaluation purpose by the external agencies, which might be seen through NQAS or NABH, JCI, ISO, are known as performance indicators. So you need to see the clear distinguish between the clinical indicators and the performance indicators. The types of clinical indicators by the purpose, where we find the categorization is fully based on the purpose, where you may find actually the clinical indicators here emphasizing more on the internal quality improvement efforts and even on the focus of clinic and the hospital, process and outcome specific. Where versus on the other side, the performance indicators are being seen for external evaluation by the team which is come by external experts. Public or payers focus is one which will give you the emphasis of performance indicators and system-wide and comparative part of that. Now, we will see in detail what is clinical indicator as. A clinical indicator refers to a measurable science or data points used to assess specific medical conditions and determine the overall quality of healthcare. So it is one way actually that you can see the entire healthcare with the help of the clinical indicator. So these indicators include concrete data from the laboratory test, such as measuring 25 OHD levels in the blood for vitamin D status or HbA1c for monitoring the diabetes management. These also involve visible symptoms that guide a medical decision, which is very important to be focused on. Clinical indicators are crucial for efforts to improve quality as they inform the development of the best practices and the treatment methods. You may see that most of the hospitals which are praised actually for the best practices and the treatment methods and even being uttered by most of the medical physicians, they said that these hospitals work more better on the clinical indicators. Furthermore, to add on this, they help evaluate the health status of both human patients and animals. By highlighting specific health measures, they clearly identify where targeted medical actions are necessary, which is one way that you can show that there is an improvement mostly done with the help of the clinical indicators. Let me just come with the types and classification of clinical indicators. By measurement type, we can say the clinical indicators can be sorted in two main groups. The main groups are based on how they are measured. One is like the rate-based indicators, the first and the very important and the most common type. They are expressed as proportion or rate that has been defined, that is numerator, the number of observed events, and a clear denominator, the total number of people or the cases has been taken. So numerator and denominator. So you need to see with the help of this example, how would I like to portray this rate-based indicator. The example is like the share of hip fractures patient who receive antibiotics before their operation. So you may find a numerator and the denominator. Total number of braces versus the numerator of the share of hip fracture patients who have received antibiotics. Then comes in second line, that is the count based indicators, that is the sentinel events. These are simple counts typically used for rare, highly undesirable events and sometimes called as sentinel events. These are something that the organization don't expect. But you need to focus on this. If though there is an incidence that we can see that the sentinel event happened, it is to be counted into the counter based indicators. They often measure the safety aspect of the care, which is more coming into the gamut of patient safety. The example can be identifying sentinel events such as a surgeon who has accidentally leaving something inside a patient or operating on the wrong part of the body. There are many incidents that you will be knowing that the surgeon has accidentally left a gauze or a scissor or something into the patient's stomach while operating, or the surgeon has operated a wrong part of the body. This might be one of the event actually which may be counted, and there might be many such events which can be taken into sentinel events, where you find typically they are an undesirable events. The hospital don't expect such an undesirable events. When the goal is to improve quality, every single of these undesirable, unexpected event leads to a detailed investigation, where the team, the quality team or the hospital needs to emphasize on preventing it from happening again. Where sometimes unexpectedly also you may come across with such events in your hospital. What is the scope of application of these clinical indicators? These indicators can also be separate based on which patients they apply to. In the category of the patients, you may find actually there are generic indicators and disease specific indicators. These generic indicators measure aspects of the care that are relevant to all patients. Means like it is applicable to all patients regardless of their illness. Means like it can be used for everyone as a measure. For example, the percentage of patients who waited for more than 6 hours in the emergency room. So it is very important to improve the indicator of the emergency room, and to improve the process over there, you need to set up an indicator which will increase the scope, but the measure is based on the generic. Where versus on the second part of disease specific indicator, these are only relevant for patients who have a specific diagnosis, particularly to disease condition like cancer, diabetes, renal failure and so on. You may categorize according to the patients with respect to the department or specialty. For example, the percentage of lung cancer patients who are still alive 30 days after their surgery, which is a very important indicator to prove the improving health outcome. Working on the diagnosis of the disease along with the comorbidities, seeing the improvement of the patient with respect to the care given. Also to emphasize the focus on infection prevention and control practices in the hospital. By quality focus and data source. So on the basis of the classification, that we can see how it is mostly based on the quality focus and data source, that you can make a classification of that. The classification will give you the importance of how on the basis of quality you can identify and you can make best of the differentiation. By quality aspect, indicators can be grouped by the specific dimensions of quality they assess. The quality is being assessed in several ways. One is like effectiveness, second is the patient safety, and the third is the patient centeredness. All are very important with respect to quality aspects. And thereby you may find the indicators are more in quality being derived with respect to the dimensions the quality is being taken. So you can find that these are the three dimensions of quality: the effectiveness of care, patient safety and patient centeredness. It can be interchangeably used at patient centeredness or patient safety, but I just want to make it more clear that patient safety is more relevant actually to the harm which is one we need to prevent on, and patient centeredness is the one specific care actually which is more focused with the need and recall of the patient. Next is by healthcare function. How the healthcare function works, on that basis you may find this indicator has been developed. Indicators can be organized by the type of medical service they cover in, like the prevention part, that is acute care, chronic care or palliative care. You may not use interchangeably the palliative care with the chronic care, but yes, chronic care to an extent which may see that of, I may say, the end of life care or debilitated patient actually like cancer, AIDS and so on may be counted in palliative care, where you can even see such type of patients in the hospice also. So preventive part, the acute part, the chronic part and the palliative part can be seen into the healthcare function indicators. The third is by the data source, where you may find there is again a subclassification which is based on patient-based indicators and event-based indicators. With respect to patient-based indicators, I want to focus here that this requires a data link across the different departments with respect to care, locations and to the entire track actually, where the patient entire path of the care of an individual patient from the very start to the discharge is being set. So patient based indicator, individual basis, actually you can say that you can work on specific type of patient where you can segregate with respect to male, female or acute chronic conditions or specific disease condition, or you can even focus on pediatric and geriatric patient. Event based indicators, this focuses on specific occurrence. There might be incidents that a hospital can face with some of the respective conditions where you can say these are some specific occurrence, such as single hospital admission. So when you see the comparison actually that you have to take up with all these two classification, the Donabedian framework is most widely used as an indicator. That is the classification which works more on sorting the structure, process and outcome indicators. The entire framework that we have studied in the Donabedian model is to build on the ideas of the structure, used to widely provide the care influence in the processes part. And this process in turn will determine the patient's outcome. So what is the very important thing in the Donabedian model is on to focus on the healthcare processes, which needs to be improved, where versus actually we can get the more health outcome based on this model. Now, what are the key attributes of effective clinical indicators? When we have defined, when we have stated that there is a greater classification and how the organizations are taking, now need to see what are the effective attributes. How do we see that this effective clinical indicators really works for the organizations? The very first key attribute comes with the actionable part. The data must allow hospital to turn the measurement into decisions and practical steps, because this is where we find that how these indicators can benefit your organization. This can make more decision actually which will be specific to improve the health outcomes. Improvements, professionals must use analytical tools. They need to identify the specific factors contributing to the problems and examine the risk factors connected to the various patient outcomes. Might be with respect to specific patient, might be with respect to specific disease condition, might be with respect to the problems the organization is facing to treat specific group of patients. This can be called as risk factors. The analysis enables them to choose effective actions to reduce the harm, because most of the time when your systems are ineffective, you may get more harm to your patient. Therefore, actionable attribute is one a very important way of effectively dealing with clinical indicators. Next comes the data must be available quickly, because we may come across very unprecedented situations in the healthcare institution, where sometimes it cannot be one way actually to measure and by the time the incident may happen. So the data must be very quickly available. Hospital need data as close as a real-time data. You may say as possible to quickly check if there is indicators which are actions are working on, and to see the necessary adjustment right away if they aren't. So where we say that timely work is very important to focus on this part. Next line to this discussion comes with the accessible part and the comparable. Accessible makes the hospital leader must be able to access the data at the moment they need it. Otherwise, when you are waiting actually to get that data and you may not be able to retrieve it, or you may not be able to get, or your availability is very much in terms of giving you an access, then the working doesn't really helps. This must be done without compromising the patient's privacy. No doubt the ethics part comes over there, and even with respect to the data security part. So accessibility is very important for the hospital employees for all the data set, and even working on what really the data has to be with respect to patient's privacy. especially in those patients where the criticality part, actually the dignity part, and even some of the objectifying things which the patient really don't want to give is very, very important. The hospital needs to work on the cloud-based analysis tools that have the right security features and role-based permissions, which is very important to see that whenever a hospital takes the cloud-based analysis tools, actually it allows to view and analyze only the data relevant to the specific job, rather not taking the entire pool actually for the discussion, which sometimes makes a lot of confusion. Then comes the very important attribute is the comparable part. What does this comparable part gives us to you? Data should allow for benchmarking rather not to be used for any other purpose, which means comparing performance against a similar institution. The similar institutions which are developed at international level, national level, and even at the state level, where you can find the benchmarkings, really makes you that comparison helps you to improve at the next level. This is the best way that you can use comparison actually to be set it as improvement goals, where you need to emphasize to your employees in your training programs, working with the quality, that how an improvement goals is one which is very realistic. This is one help that a hospital staff may get when they learn from the comparison and measure their progress accurately, where comparison is just not only to say that you should improve, but actually you should task actually them that your performance will be measured, and that way you may find the improvement is one which can lead you actually to the comparing agencies or the institutions. For a larger hospital who has voluminous patient and number of beds, or the state groups actually, or medical college teaching hospital, these comparisons also promote communication. They help them actually to grow and integrate actually. One of the best reason of comparison is that they can share the best methods that they have taken, where you may find a lot of examples in our country has been seen with sharing the best method of their quality part to improve each other for this. Now, you can find the focus of these clinical indicators in the healthcare, where I find that when you come up with the measurement part, the measure of the science and data is being seen over here, where they access medical actions or condition to evaluate the healthcare quality. So you need to see that how the definition of this will be more focusing on this part, where versus on the example part we have given that how the HbA1c diabetes test versus to the vitamin D test is being given over. The infection rates, readmission rate, observable symptoms, this all will connect as an example of most of the situation that can give you the clinical indicators in health. So what is the purpose of developing and seeing the clinical indicators? That is the inform best practices versus actually to see that what is the guide treatment being given as one of the reasons actually you may come across. Access health status, where the patient, patients, and even patients relative can get the information for, which gives you more a reason actually to understand the clinical indicators. Identify the targeted interventions which have been done by the hospitals, and the hospitals improve on that part. Lastly, coming on the significance or utility part of the clinical indicators, that is drive quality improvement, because the quality improvement drive which is being taken by the hospital needs to see that this is one reason actually where you're working on the clinical indicators and you are getting the benefit of this. Even the importance can be emphasized to be seen as a support data driven decision, which is very important part. The hospital is getting more benefit because of the data. No doubt there will be an outcome which is being focused by enhancing patient safety, which may be seen as one of the most important of the clinical indicator. And no doubt with this we can see that increased patient trust is being also being seen over here. Now, the indicator development process we will see over here, how the clinical indicator development process is occurring. The creation of new quality indicators follows two steps, where you find the clinical indicator also has to go with this planning phase. Second is the development phase. The planning phase is one which the process begins with the planning. During this initial step or the first step, as you can say, the following actions are taken. What are the actions? The actions are the specific clinical area that needs evaluation is chosen. Example, patient safety in surgery, patient safety in gynec ward, patient safety in any geriatric ward, or care for a heart patient. So you may find that it is developed more on the planning phase. A dedicated measurement team is selected and organized to management of the development work that is being done over there. So where it entirely gives you the frame of the planning phase. Aligned to it is the development phase, which gives you the measurement the team performs. There are several tasks that the team will do. So it will give you what is the next level they have done, that is the specific development phase. The team reviews the existing scientific literature. They will go with the documentation to select, and that will prioritize actually how to appropriately work on the clinical indicators. So both of these steps are aligned to each other, planning followed by development phase. Then comes the discussion of testing and refinement. With respect to that, the part which is aligned to it is like the measurement part. After the indicators are chosen, the team writes the measure specification. They will work on the rules which are defined by the organization and the criteria for including or excluding the patient, the strategy for the risk adjustment, or they may find out the differences actually how the sick patients are, or identification of data sources and procedures for data collection. So it will help actually the entire process to be completed. The third part would be testing and refinement. Before the clinical indicators are put into use or put into practice, they need to be tested, because it cannot only just work on the planning phase or the development phase, that you have set it, the team has met, it has completed the plan, but the team is not developing. What needs to be the completing the development phase as before the indicators are set up to be used, they must be tested. The test must be on the reliability, that test must be on the validity. These initial tests often shows the area where the indicator need further improvement or further changes, and sometimes you may seek a clarification from the experts, internal or external, or sometimes you may need to work on specification with respect to the comments which are given or suggestions which are given by your quality team. So testing and refinement is the one essential part needs to be completed at the last. Now, application in various clinical areas, which is very interesting to see that with the examples I am trying to portray over here, what are the application based part of this, where you find the acute heart care actually, where the first example is giving the percentage of patients presenting with heart attack who receive aspirin upon arrival at the hospital. So what are the things? Measures the timelines of the initial and critical and treatment part, where you may find that the acute heart attack care is being settled over there with the application of these clinical areas. Then very important is the infection control. Infection, the rate of the central line associated bloodstream infection, the CLABSI, per 1000 days as a central line is in the use in the ICU. What is major adherence to sterile practices and infection prevention? Next is the medication safety part. The medication safety part, the percentage of patient whom home medication list is accurately compared against the new hospital orders, where is medication reconciliation within 24 hours of the admission. What does it measure? It measures a process designed to prevent serious medication error. So there is a problem actually that the medication error may happen and you have tried to prevent it actually. Okay. The next example comes pressure ulcer prevention. You may come across many cases in your hospital where you may see the patients are developed with bed sores. To improve this, actually you may work on this indicator, developing an indicator. The number of patients who develop a pressure sore, or you may say a bed sore, during the stay in the hospital per 1000 patients day. Measure the quality of nursing care given to them, measure the quality of care delivered actually with respect to infection, and even the skin management protocol. This might be very benefiting actually to reduce the number of patients who are suffering from this condition. Then comes the chronic diabetes management. The chronic diabetes management is one and very important issue nowadays with the organization, because number of patients which are increasing with the non-communicable disease, you may find diabetic patient as one of the majority of the patients. The percent of patient actually which comes with diabetes whose most recent blood test showed that their long-term blood sugar level is at or below the targeted. measures the effectiveness of ongoing care in controlling the disease. It might be good, it might be bad, or sometimes we may say that you need to work on this with a better effective drug. It gives you the entire ongoing care, which is whether you are controlling the disease or whether you are in a step actually to take more diagnostic performance actually. So with these examples, I may try to see that the application is much more clearer to you with respect to the clinical indicators. Now at the last, we may see that when we have studied the clinical indicators and we have seen the entire gamut of that, we may say that indicator is a measurable feature of care which is supported by evidence, and it is very important that when you reflect to see it from the quality purpose, you need to work on the improvement. While the performance indicators are for external evaluation. So clinical indicators include your lab test, which I have stated over here with respect to symptoms, the crucial practices, and one of the developing best practices where you can see and compare also. Indicators are classified in different ways, rate-based and count-based, where you may see that most of the time the organization is not expecting the count-based indicator, where the undesirable events are ones which are disguising actually the organization. Indicators are also classified by the action, generic or disease specific. Effective indicators must be actionable, they must be timely, they must be accessible and comparable. These are one of the important virtues that the indicators need to focus on. Without that, you may not even be able to get an help if you are even taking all the measures and data of this indicator. The Donabedin framework is the most important classification that sorted actually the indicators into structure, process and outcome, where it reflects on the organizational steps, the efforts, the action that affects the results. New indicators are developed through planning phase. It has to go through a development phase, and rightly as said, it has to be tested in terms of the reliability and the validity, without which it cannot be really completed. So these are the references that I have used for this particular chapter. You need to focus on developing an evidence-based clinical indicators and work on the data that you receive in your organization with respect to the indicators, where focus on quality indicators is lying more into the hands of the employees over there. How you develop, how you work and how you measure them. So thank you for the day.